Governor, if a significant problem is people ignoring the gathering rules and blowing past the 15, realistically speaking, how much of a difference is lowering it from 15 to 10 going to make if some of those people were still following the rules? So if the rule followers are like, I've been following the rules and I'm not the problem, and the source of the problem is these larger groups, what realistically do you hope to accomplish with that small change from 15 to 10 people?
I think a few things. I think number one, it's a signal. It's a signal. You know, we haven't been at 10 for a while, and it's a signal that it's time to really hunker down and reevaluate our lives. Secondly, it is true what you say, that people are trying hard to follow the rules, and in particular we're seeing really good compliance at work, in schools, at restaurants, etc. I think if we're all honest with each other, we're not actually following the rules very well in our own casual settings. And we have had, as I think I explained, the average party, I think, was 23 people. So why did we pick 10? We know that in the events above 10 people, that's where we're seeing the biggest problems. Events greater than 10, we're seeing the biggest problems. But also, if you think about it, you know, you have your family, 4, 5, 6, 7 people, and then a couple other people. That's your 10, and that's who you should be staying with, and that's it. So that's how I think about it.
People just resisted up until now. You surely expect some pushback against this.
I do. As I said, I don't think anything I just said is popular, necessarily. I view it to be necessary. Rhode Island's in a tough spot right now. We've been dealt a really tough hand, and I don't have any easy decisions, and I am back in a place of deciding between bad option number 1 and bad option number 2. So that's why I'm telling you where we are. Where we are is not a good place. The trajectory we're on, we've doubled our hospitalizations in 3 weeks. If we do that again in the next 3 weeks, we're in trouble. So that much I know. I'm looking at the data. It's what I've already said, these unstructured casual gatherings with people we know not wearing masks. So I need to do something about that. And we got to keep people at work and kids in school. So in those parameters, we're trying for the next couple of weeks, this is a call out to the people of Rhode Island to be very disciplined in the next couple of weeks, so that we can hope to avoid, you know, a broader set of blunter regulations that would hurt commerce.
Governor, you mentioned that faith leaders should move to virtual, yet schools are, by and large, staying in person. You say people shouldn't carpool, yet, you say people shouldn't carpool, yet school buses are still rolling. So how do you square those things?
Great questions. First of all, if people carpool with masks and windows open, as the children are on the school bus, it would be fine. But you know yourself, when you get into the car with all your best friends who you work with, we all get a little bit lax. So if you want to carpool, and listen, my dad carpooled every day to the factory, like people who work in manufacturing get in the carpool, fine. Put your mask on, even if it's with your buddies, and keep the windows open, like we're doing on school buses. Virtual school doesn't work well. We know that. The kids struggle, the kids fall behind, and right now the data is very clear. We're having a harder time controlling the virus among the kids learning virtually than we are with the kids in the structured environment. So to me, it's crystal clear. And by the way, a study of dozens and dozens of countries and states show the same thing.
Governor, with the onset of the elections on Tuesday, not only is it Halloween weekend per se, but this is also a period of days when there are a number of events. Now you're talking about honkin' waves, you're talking about door-to-door canvassing, you're talking about parties election night. Are you essentially putting the kibosh
Yes.
you on all that?
Yes, which is why I'm here today and didn't wait. It's yes. Yes, yes, yes. No election night parties. No day after the election parties. I I suppose a honk and wave could be safe, but yeah, 100% Halloween, followed by what looks to be a contentious and emotional election, followed a few weeks thereafter by Thanksgiving. That's the point I'm trying to make. Right now, right in this moment, it's a kind of a call to action.
One follow-up. What type of, for all of this increased enforcement, what type of due process exists for those folks who would like to contest these fines, which can potentially be onerous?
Yeah, excellent question. So first of all, I want to be clear. As I said, for instance, with that party in the East Bay, first we're going to get to the bottom of it, right? We're going to see, is it as egregious as we thought? Were there more than 15 people there, et cetera? Secondly, it's like anything else. I mean, it's like any other civil violation with a fine that a police officer, or in the case of DBR, would levy. Standard due process.
So there will be, people will have the opportunity to have hearings?
Absolutely.
Governor, related to the fines, you mentioned earlier in the week that contact tracers are having a lot of trouble getting contacts. If you are contact tracing and going back and finding people, finding the host based on the number of contacts, are you concerned that's going to drive down contact tracing cooperation?
It's a risk. It's like everything else. It's a balance. I'll tell you, like I said, state police will be tripling their manpower over the weekend, similar with localities. I've been in touch with mayors. DBR is putting more inspectors on. So if we show up at a grocery store or wherever and 10 people don't have a mask on, I could tell you right now, that store is going to be fined. If they show up at a house this weekend and there's 11 people there, there's going to be a fine. And the same thing if it comes up in contact tracing. So look, it's in nobody's interest to lie to the contact tracers, but you know, I hear what you're saying, but I think net, the right thing is enforcement.
On travel, on travel, we are cracking down on a lot of these social gatherings with cases rising. At the same time, Connecticut is easing travel on Rhode Island. And it sounds like you have another cooperative arrangement with governors. You could tell me which ones, that would be great. But are you concerned about sending a signal to encourage interstate travel at a time you're trying to prevent more spread?
I'm not. So I'm very grateful that Governor Lamont did that, and I'm hopeful and hoping that Governor Baker will follow suit, and I'm in touch with both of them regularly. The message isn't travel freely. You know, the message is not encouraging travel. In fact, I'm asking folks to stay home and close to home, you know. But the fact of the matter is, like, it was hurting commerce. Again, I don't want to close businesses. I don't want to hurt commerce. I don't want more people to lose their jobs. So Connecticut has a very similar public health approach to us: mandatory mask wearing, really good enforcement. So I think I'm not worried about the messaging. If anything, it's just a nod to the fact that we share so much interstate commerce that it's just a practical thing to have a regional approach.
Governor, if I understood that, we're really looking at an age breakout of the people in the hospitals are people in their 60s, 70s, and 80s. Any thoughts to then restrictions for those individuals as opposed to treating everyone the same?
Well, that's why we're going to tighten up visitation to nursing homes and hospitals, and that's why we have every 7 days everyone in nursing homes and hospitals is tested. But the problem is, John, it's the young people giving it to the older people.
But what about, let's just say, college students at Brown or PC that they live in their own world where they just interact with people their own age, and it just seems that granted, if you're over 60 or if you're obese, underlying health conditions, you have to be careful. But, you know, young kids, college students, they're not in the hospital. They're not being affected by this.
That's true, but they don't live in their own world. If they did stay in their own bubble, that would be terrific. But they don't. They go to work. By the way, they should work. I'm not saying this, but, you know, they go to work. They might work at a grocery store. They might wait on someone's grandma. they go to the gym, they go to wherever they go, out for dinner.
But is it maybe that then the onus falls on to those older individuals to be careful around younger people
Yes.
that could have it?
Yes, and they should.
Okay.
I mean, if you are an older person, you should be taking extreme precaution. The problem with this, it's an infectious disease. It's just really hard to control, and once you get past the tipping point, which is what I'm trying to avoid, it really blossoms. So,
And I just
yeah,
want to crystallize, it comes down to hospitalizations, correct?
essentially, yes.
So, I mean, that's really the
It
number
does.
we're looking at. And just quick follow-up, I thought the other day you had mentioned the way Massachusetts had a color code, that maybe we were exploring that, because, for instance, Central Falls is over 10%, yet they're treated the same as a community that is very, very low. Any thought, is that something
Yes.
that could be implemented?
Yes.
Okay.
Yes, we are looking at that. So as I said, today is like part one of a two-part press conference. I had to get out today and do something because we have to put a lid on it. It's big weekend coming up. We've got a big election coming up. Can't wait. I'm going to spend the next few days talking to Baker and Lamont, talking to the mayors, looking through the data, and I could see myself doing something like that next Thursday, or not. You know, Rhode Island is different. We're small and we're dense, but it's on the table.
Governor, the pushback,
Speaking of Massachusetts, you know, what they're saying is that the data from this new spike, these latest cases, seems to be less connected to social gatherings and more connected to households, people actually transmitting within their own households, the people they live with. Are you seeing differences in Rhode Island compared to that?
I can't speak to Massachusetts, so I want to let that be. I can tell you that I've been talking to Governor Baker almost daily, and he tells me he's seeing similar trends, so I'll leave it at that. And as I said, they closed ice rinks, they've done some other things before us, so I know they're having those troubles. We're seeing spread in houses, but not necessarily in just a household. You know, so you definitely, you know, you invite your friends to sleep over. We're seeing it's friend gatherings. The problem, like the enemy is familiarity in a weird way. You just let your guard down when you're with people who you know. And so that's where we are seeing the problem. And the truth of it is, look, we're seeing a lot of birthday parties, backyard parties, football game parties, baby showers, wedding showers. Those are the things.
Governor, you mentioned that you floated the idea of going back to phase 2. I didn't hear you say that in your remarks. Why did you decide?
All right, we're not doing that right now. Two reasons. One, commerce. Commerce. We got it. Too many people are already out of work. And if I can keep a lid on this without dialing back commerce, that is the preferred route. So just like as I stand here on Friday afternoon, I'm not ready to do that just yet. I may have to go there next Thursday. We'll see. Also, as I said, I'm trying to keep it targeted. We know we're having certain problems, and so what I've just rolled out is targeted at those problems.
Governor, the pushback on the hospitalization, the dire warning about the hospitalizations, is that you never used the field hospital, didn't have to back in the spring, and that hospitalizations now, even though the cases are actually on some days higher than they were in the spring, the hospitalizations are still less than half. And you mentioned the rate. It seemed like there was a big jump in early October, the first couple of weeks. And while there's still an increase over the past couple of weeks, it's not as great. So what's your response to some pushback on being overly dramatic about the hospitalization rate and talking about the field hospitals when we're not where we were in the spring with that?
Okay, so this right here, what you just said, is the challenge. I don't want to ever open that field hospital. I consider it a victory that we had it ready and didn't have to use it. That would be 300 people's lives who are in the hospital who don't need to be. That would be $50 million a month of state money or federal money keeping it running. So that's a good thing that we don't open it. So what I'm trying to say now is, you know, get your own statistician if you don't believe me, like climb through the data. We are on a path right now, if we don't make a change, to have to open it in about 4 weeks. Doubling every 20 days with what we know, with what we're seeing in the data. the increase in our test positivity. The virus has a pretty aggressive attack rate right now. So hopefully, I don't want you to come to me in 4 weeks and say, hey, Gov, you didn't open the hospital, you were not telling the truth. That's the whole plan. If everybody, kind of reduces their social gatherings this weekend and next week, that is the goal, to not open it.
And just, you mentioned some of the case numbers and the data around these parties and what you saw with these get-togethers. Do you have any case data on the sports spectators and hockey to back up what you're doing and kind of what the spread has been in those situations?
Maybe the doctor can hold me out. I know that 1/3 of all of our sports-related cases are related to hockey, specifically. And do you have anything else to add?
Over the past 3 months, there have been 96 sports cases. 70% of those cases were associated with 4 specific sports: baseball, football, hockey, which, as the governor said, was 1/3, soccer, which is about 23% of the cases. And a key component is, of the 96 cases identified, we had over 970 contacts that needed to be quarantined, and that number is still climbing. So it's partially the sport activity, it's more so all of the work and the resources that it pulls from the system that occurs. The socializing before, the socializing after, the number of contacts, the number of athletes that are on more than one team. You can have one individual that causes 60 or so contacts to occur. So that's really the association.
Do you know how much of it is the parents? How many of the percentage of cases is actually parents and not the kids?
We have, I don't have that exact number, but we'll get that for you.
Just on that point, with respect to indoor sports, I spoke with the general manager at one of the most popular indoor sporting facilities in the state. He says they're already looking at test results, they're temperature checking, there's the compliance with, how you feel that day, all of that's occurring. They're cleaning, they're doing everything they can. In fact, their bars are closed, they're reducing spectators. So a week from now, what is going to change that'll make a significant impact, and why not just either close down youth sports as a whole, and I guess, in other words, what's going to shift in a week or two that will make it worth continuing to have youth sports if it's such a dangerous place for the virus?
There's much more we can do in the partnership together. The work that goes into identifying all of those contacts, getting all of the contact information of the people who were there, helping to ensure that folks understand what they need to do, how to quarantine, making sure that people have the information on how to get tested or what they need to do. We want to really work together on solidifying those types of requirements and really expand the partnership on how we can do that together and more effectively. Knowing that the goal is for youth to be able to engage in sports, but there are a number of additional steps that we can do in our state and in the region to help us do it safer.
Can I say something now? There's no guarantee that we're reopening in a week. That would be a great outcome, but we need to sit down with the ice rinks, with the facilities, and say, have a discussion. These are the conditions under which we think it would work. For instance, there's a lot of travel with hockey right now. That's not a good thing. There's a lot of non-mask wearing. It's not just kids, adults playing hockey at ice rinks. So we're going to have a really serious discussion around what would they have to comply with in order to reopen, and hopefully we decide the answer is yes. But just to be clear, this could very well last more than a week if we can't come to some shared understanding that there's a way to do it safely, and we're going to have strict compliance.
Last speaker, Brendan, John, Steve.
Governor, just a couple of sports-related questions. What's your message to spectators now, especially at the high school level, again, playoff time?
they're not going to be able to watch their kids. What's your message to them?
Yeah. Could I please clarify something that I left out? The new rules do not apply to college or professional. So the NCAA rules will apply to college, and the professional league rules apply to the professional league rules. So here's the message. The reason it's 2 weeks, we want them to finish their season. So the choices were, do you shut it down or do you let them finish their season? We've seen as much of a problem with spectators as we are with the kids. So we are asking the parents to hold back for 2 weeks. Hopefully they'll be able to go watch the playoffs, because the playoffs are after 2 weeks. So it's like, bear with us now, stay away for 2 weeks, so hopefully you can go watch the kids in the playoffs. And also, like I said, when we do the final regulations, we're going to allow some spectators for the littlest kids. So, you know, mom or dad or somebody could go watch the little kids. But the bottom line is, I think it's what's necessary for the next 2 weeks in order to let them finish their season and go ahead to do the playoffs. And hopefully you can go watch for the playoffs.
Along those lines, your message to the high school student athletes and the coaches to make sure that they get to finish their season. I'm sure there's a lot of them breathing a sigh of relief right now.
Yeah, it's a priority of mine to let the athletes and their coaches finish their season. I should say the coaches and the leaders of the Interscholastic League have been amazing, like Herculean efforts to keep these kids playing, and it is because of that that they've been allowed to continue to play. You know, having been a student athlete and seeing the impact of that on myself and my kids, I think it's necessary. So we want the kids to keep playing and finish their season. Also, I don't exactly know what the rules will be for winter sports. We are starting to work on that, but I'm hopeful that there will be some winter sports.
Follow-up to Dr. Alexander Scott. You mentioned football. What level of football were you referencing the number of cases?
I don't know.
And I'll let Director Coit certainly add to the extent that she would like to. Our requirement had been that football was only limited to practice and not competitive sports. Again, a credit to the Rhode Island Interscholastic League. They've worked closely with us to help ensure those types of rules are followed. There are scenarios outside of that where it hasn't been followed. The more you have people coming together competitively, without a mask, without the distancing, the higher the risk. So I need to get back to you as to whether it was just in competitive versus the practice, but it was in a scenario that we were asking to not take place.
Governor, much of what you said today was based on 2 weeks. And I'm wondering if there's some sort of magic to 2 weeks. Are you expecting something after that 2-week period to improve, or some sort of signal that would say we can go to another phase? And then secondly, you endorsed going outside and outside events. Do these regulations in terms of 10 or less now apply to outside events as well?
No. I'll answer the second question first because it's a quick answer. No. So the 10 is just social gatherings. So it's everything I put up on that slide. All the other, I mean, if it's in your backyard, it certainly applies. But if you're asking me like weddings and catered events and all those regulations, those are still as they were.
Well, sort of like the Tuxet Marketplace that is happening on Saturdays, where the first time that it occurred a couple of weeks ago, there were actually 1,000 people there.
Yeah. At this point, that may change next Thursday for part 2 of these regulations, but right now, as of now, all the commerce rules remain intact. So something like that, official gathering, farmers markets, weddings, indoor events, restaurants, all the existing rules apply. I'm trying to see if we can stem the tide before having to take some of those measures.
Governor, Twin River, unaffected by any of the
At the
new...
moment,
Okay.
at the moment.
And what about, I'm getting messages of people like rallies and protests. For instance, Wednesday, there's a rally already planned at the State House post-day election. That's not a protest, that's just a rally, large outdoor gathering, a lot of people close together.
You know, it would violate the rules. It's going to be more than 10. It's a gathering. People have a right, First Amendment rights, so we're going to handle it the way I have allowed the protests to go on throughout this. We won't be heavy-handed in our approach. I'd ask you not to do it because it's a gathering more than 10. If you're going to be there, wear your mask. We'll be there, passing out masks and enforcing social distancing.
Do you worship virtually, or do you go and...
We have been going to Mass in person.
Okay. And that's not a problem, because just virtually you can't get communion.
Correct. And again, it's not, like I said, if you go to church or wherever you worship, wear your mask, go in, have your service, leave, go right home, that could be okay. But the temptation to chat with your friends on the way in is great. So if you think you can be truly disciplined, stay away, wear your mask, and go home right away, it could be fine. But if you think you can't, I'm asking you to worship virtually.
Governor, I get questions as we stand here. If you'll allow me two from people. One is, what do you tell people who share placement with a child? Both of their households have multiple people in it. That would seem a difficult question.
Yeah, so those are people you live with. And I would say, in that case, you have to use your judgment. And those are your family. So back to the point of write down on a piece of paper who you must be with. That's your family. You live with them. They're on your list. Inviting friends over, going out to work, going out with your colleagues, that's what's going to stop.
Both households would qualify as your family. And secondly, I received a video today from a person of their child in a high school, and today was our first day of snowfall. And today they were in school, sent a video home of their child all bundled up, all the windows were open, the heat's not on in the school. What do you
So that should be fixed. So they should call the school and see if they can get the heat on. There's no good answers right now. Like, this is about what's the least bad, most healthy, least harmful option. And I think being in school, learning with your friends in a structured environment, even if you're chilly, is a better option than shutting the school down.
School's got to meet them halfway, though, right?
I don't know that school. I am not there, so I don't want to criticize anyone, but, put the heat on.
Thank you. Governor, one of the things that seems to confuse people is any kind of disparate treatment. We've talked about carpools versus school buses, school classrooms versus manufacturing facilities. And I would raise that in the context of protests. And with the election coming up, I think people are going to be very actively interested. Many people, I think, are going to be upset with whatever the result is and will want to protest and demonstrate. And lately there have been in Rhode Island, particularly in Providence, protests about the moped driver and so on. And you've said clearly that you feel that sort of protest violates your rules. But on the other hand, you've said you don't want to be heavy-handed. And while I understand that disparate treatment of disparate groups is kind of, to put it coarsely, like saying, okay, we're going to have an authorized section of the swimming pool where we let you urinate. And that's not going to work with an infectious disease, and we all know that. But you can't, obviously you're not trying to stop protests. So in that context, what is your guidance to the police, to law enforcement, to mayors, to cities and towns who may not share your tolerant view of protesting and seeing it as a necessary First Amendment activity? And are you concerned that the lack of buy-in from police, law enforcement, mayors, and so forth on allowing protests could result in crackdowns, arrests,
Yes,
and even violence.
Listen, you make a good point. I'm clear. Gatherings of any kind greater than 10 people break the rules. That is clear. You have to ask yourself, what's the right way to enforce that rule in order to get compliance and the result you need? Escalating a situation and being heavy-handed could just increase the violence and actually decrease compliance. So our approach to these protests has been more born out of like practical concerns and not out of a ideology per se. So we're trying to, like I just said to John, like we're trying to, I'm discouraging it. To be clear, I am discouraging it. Figure out another way to exercise your First Amendment right without congregating in big groups. If it does happen, though, you know, rather than starting an altercation over mask wearing, we're going to give you a mask. We're going to give you a mask. We're going to ask you to go home, but we're not going to, you know, escalate a situation. And as it relates to disparate treatment, that's what's required right now. You know, there's just certain environments where we're not seeing spread, and the societal benefits to enabling that are huge. There's other environments where, I mean, why is anyone allowing their kids to have a 20-person party at this stage of the game? Why? So yeah, we're cracking down on that pretty hard, because it's got to stop right now. So it's, we have a goal. We have a goal. Keep people out of the hospital, keep the hospitals to be not overwhelmed, keep people at work, and keep this virus like at a stable place until we have a vaccine. And I'm going to use all the tools in my toolbox to get that goal, to get to that goal. But anyway, remember, I'm back next Thursday. This is step one. So when I come back next week with different rules, don't say they were different than Friday. I'm telling you now, there may be more next week once we think about it some more.
One last question. Is the Boston Consulting Group, are they involved in these ongoing?
Not anymore, no. Okay. They were excellent in the beginning, but we, for months, we haven't engaged them. Initially, I said there were 5 cases from that one party. We're now up to 12 cases. In the East Bay. So you could easily see 500 people being quarantined. And that could take, then 4 different school districts. Like, those are the kinds of disruptive things that just have to stop.